we did a coronary calcium scan and it came back as positive for having plaque in my arteries. And that was devastating for me because I have 3 young kids. I am in my 30s and I just found out that I had heart disease. Knowing that I have the same genetic condition that my grandfather passed away of when he was 46 years old was super scary to me. He didn't have a chance to see his children grow up. He didn't have a chance to meet his grandchildren. So I was really aware that having a heart attack was a possibility. And so emotionally, that was really hard to get through. And then knowing too that this is a genetic condition that potentially more family members and my children could have.
We started the Preventive Cardiology Clinic in 2019 because we found that identifying genetic mutations sooner allows us to move further upstream. These are folks that are born with a mutation, and so their cholesterols are high from the get-go. And in research, what we understand is there are a lot of things we don't understand. The idea of having a research program and bringing research into Intermountain allows us to innovate. It allows us to take what we do now, what we think is best practice, but make it best practice.
It's really nice that there is a research facility close to us, and they're always like, have our best interests at heart. So if there is a new research trial or something there, they always bring it up to us, and we know that it's just 20 minutes away, and so it is something that's doable for us.
At her young age, there is a lot to be anxious about when you consider, something that you weren't able to really choose, a genetic disposition to have high cholesterol and high risk. And she's turned that into, I'm not giving up. How do I fight this? And how do I reduce my risk? I can take control of what's available to me, and that is partnering with folks.
If it wasn't for research and clinical trials, I wouldn't have the treatment options that I have. I wouldn't have the hope that I have. And because of that, I am able to have medicine options with more coming. So I really appreciate all the work that researchers and Intermountain has done to focus on the patient and to find good options for us. I just appreciate that.
That's really why Intermountain stands behind research, is to innovate and provide patients the opportunity to live that healthiest life possible.
My grandfather had a sudden heart attack when he was 46 years old and he passed away. My dad was just 8 years old at the time, but the big difference between his situation and mine is that I have access to treatment options and medicine with more on the horizon. And I am very hopeful that with those treatment options that I'll be able to watch my own kids grow up and meet my grandchildren, because it is such a scary genetic condition to have and you feel helpless, but I do have that comfort that I have these treatment options.